Every now and then I get to pull up a chair and talk directly with you, just us. Today I'm sharing some updates that are close to my heart, a meaningful moment from the field, the principles guiding our work this year, and what we have coming up inside of our community. You're listening to the PHEC Podcast, episode 450. Welcome to the Public Health Epidemiology Conversations Podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners, as well as the broader communities that they serve. The support that we provide often falls in categories of strategic planning and sometimes capacity building. It just depends upon the needs of our clients. So please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes for you. Sometimes the best conversations happen one-on-one, and that's exactly what this episode is, a one-on-one conversation. I'm sitting down with you today to share a few things that are on my heart, a meaningful moment from a recent panel that I had the privilege of moderating, the community principles that are shaping how we show up in this year, 2026, and everything we have coming up inside of our PHEC Podcast Community that I'm very excited to share with you about. I hope you'll walk away feeling connected, informed, and ready to get involved. So let's start with community. So community is our word of the year. And if you caught the bonus episode back in January, you really know why. You know fully why this has such meaning for me. But for those of you who are just tuning in, here's a short version of that. After 8 years in business and one of the hardest years of my personal and professional life, community was the strategy that carried us through. I shared 10 principles in that episode, things that I've always believed and that 2025 made undeniably clear. Community is strategic. It is our origin story. It strengthens teams from the inside. It deepens clients' trust, the relationship with our clients, especially in hard times. It supports personal healing in ways that nothing else can. It requires real investment and real infrastructure. It is our path forward. It drives innovation. It transcends borders. And it's our legacy work, generational, meaningful, and lasting. These aren't new ideas for us. Community has always been at the center of how we operate and how we show up. 2025 just made it that much clearer to us, like more clear to us than ever. And now we're building on that foundation with intention. So when I say community is strategic, that's what I mean. We have an intention and we're building upon that. I'll make sure that we have links to that bonus episode in the show notes. It's not a very long episode, and I really encourage you to listen to that. Maybe you heard it, you're not really remembering, but it's only a few minutes, so it's really worth the listen again if you haven't, or like I said, if you heard it again, it's been a while. Okay, so now I want to share something that happened recently that is a perfect example of community in action. I was invited to moderate a panel discussion with community leaders at the South Carolina Public Health Association's annual meeting. Now, moderation is something I genuinely enjoy, and I do it regularly. It connects directly to my consulting work, where I'm often facilitating real conversations between community partners and the communities they serve. When I received the invitation, I was given the freedom to shape the conversation and bring additional voices into the room. I invited Catawba Nation representatives to join the discussion. As the only federally recognized tribal nation in South Carolina, their presence added an important dimension. A representative, Gullah Geechee Nation representative, was also part of the panel, invited by the conference organizers. So I set the tone early. There were no slides, no formal presentations, just a real conversation with the panelists and the audience that was ready to engage. It was phenomenal. And as I think about it, it just really gives me goosebumps almost to just relive this moment as I'm talking to you about it. Creating space for moments like that is always my intention as a moderator. And in that room, it happened more than once. This conference was also personally meaningful for me. Some of you may be aware that I live in South Carolina. It's my home state. Being able to show up there in this way felt really good. I know that our Gullah Geechee Nation leader, Queen Quet is her name, she and her team recorded the entire conversation, and they're editing and preparing to share that on their YouTube channel. So if you would like to see or that whole conversation that I moderated and that experience, be able to experience that, we'll be able to share links to that recording, which will be on her YouTube channel. And I encourage you to explore her YouTube channel and really get to know her. She's a phenomenal leader and speaker, and this is a great way for us to, you can engage with what's happening here in South Carolina and further connect. So I'm not sure at the time that you hear this recording, the YouTube video may not be available, but as soon as it is available, we will add it to our show notes page. So for example, if you're listening to this episode shortly after it was released and you're on the show notes page and you don't see the link to that video, then return back. As soon as she lets me know it's available, I will add that link to our show notes page. All right. Now I want to tell you about what's coming up inside of our PHEC Podcast Community in April. And actually what's coming up in April is a taste of what will continue to be created we'll have similar types of events in the months that follow. We have a full month of events, and I'm just really excited about every single one of them. We are kicking off April 2nd with Power Hour, which is our virtual co-working. In this 15-minute focused work session where members come together and tackle their to-do lists with built-in accountability and supportive energy. There's no pressure, just productivity. I encourage you to experience it because you have to experience it to really understand. It's its own vibe. On April 8th, we have Start Where You Are, a real talk session on advocacy, burnout, and finding one small action you can take wherever you are right now. Whatever your capacity, there's a place for you in that conversation. On April 21st, we are having Carrying the Invisible Load. Now, this is an honest conversation about the unseen emotional and mental load that women carry and how it shows up in our health, our relationships, and our careers. This one is going to be really good. I think they're all going to be really good, but this one is just personally resonates with me as a woman who can relate to these challenges. Looking forward to that conversation. And April 22nd brings Break It to Build It. It's a forward-looking dialogue on what's broken in maternal-child health, what's emerging, and how we rebuild from the ground up. So if maternal-child health is your world, you don't want to miss this one. And we are closing the month on April 23rd with a networking party, a relaxed, interactive space to meet fellow members, share wins, practice your pitch, and build real connections with public health professionals from around the world. Now, in addition to these live events, we have on-demand spaces where we discuss podcast episodes, we share about the work that we're doing in the field, and a dedicated wellness space that includes a book club and self-care, celebrating our wins, big and small. There is always something happening and always a place for you. So if you're not able to join the live events, then those will be added to our recording library. And you can pop in whenever it fits and flows for you and engage in the community in these spaces. If you're not yet a member of the PHEC Podcast Community, then this is your invitation to come and experience what we're building. Now, community has always been our anchor. And as we move through 2026, it is also our accelerator. So we are not starting from scratch. We have the relationships, the infrastructure, and the momentum. Now we grow. And if you are a public health professional looking for a home, a place to connect, grow, and do this work alongside people who get it, the PHEC Podcast Community is waiting for you. In addition to being a part of this amazing community, your membership supports the production of this podcast and conversations we bring to you every week. You can download the PHEC Podcast Community app in your mobile app store, and it's available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.